I'm the Chief Operating Officer for a medical group in San Diego and Riverside County areas by the name of Graybill Medical Group. We partnered with Thirdway to improve our patient access and really strategize around solutions that promote an effective way to improve patient experience overall. Graybill Medical Group has been in the community for about 100 years. We are a multi-specialty medical group with a focus in primary care. We deal a lot with managed care and HMO members, and so there's a lot of emphasis around quality and patient experience, which is part of the reason why we are or have this initiative to improve access and our overall patient experience related to that. So Thirdway was first introduced to us by an evaluator at my previous employer. We got to see the value of partnership with them, which then motivated me to bring them to my new employer at Graybill Medical Group. Access via our phone system has always been a huge pain point for our organization. So we were looking for solutions over the course of 4 or 5 years at my prior organization. We ended up partnering with like an outsourced overflow service. They had no EHR access at the time, and it was super costly for our group. On top of that, the technology we had really wasn't anything that could help with efficiencies or ways to get our patients in to the phone system or for appointments with their physicians. And then with Graybill, similar situation. However, because I had a relationship with Thirdway and the amount of time that I had to stand up a call center, I trusted their partnership. I knew that they would be able to do it and get the job done. I was confident that we would be able to get the amount of agents we needed in the call center to support the amount of calls we had. Plus, we had an antiquated or lack of technology in several areas. So our primary motivators were to improve patient access and create a digital front door in the most efficient and quickest way possible, which in turn will improve our bottom line with patient retention and being able to improve quality scores in that managed care setting like I was talking about before. Thirdway is way more cost effective. We've actually never had the opportunity to do this offshore, and so obviously there's the increased cost of trying to do things like in the United States, and if we were to try to do this, it would be double if not triple the amount of cost that we're experiencing with partnership through Thirdway. We evaluated several vendors, I want to say 8 or 9 different vendors. It was a combination of those that had some sort of AI platform or those that simply were just a stand-up call center. But Thirdway really kind of was the person that we felt, because of one, their responsiveness to our concerns, kind of what they offered in that hybrid model with the live agents and the AI involved, that would help us get to where we needed to go. Those AI vendors are still pretty immature in the idea that, you know, the patients aren't going to get the same sort of like experience as they would if you're talking to a patient. A lot of the vendors we demoed, it was very robotic in terms of like the responses. Also, one of the big turnoffs for us was other vendors required an increased labor on our side, such as like a bot engineer, which we weren't prepared for at all. We're not in the space of AI at all. And so to ask us to hire a bot engineer to maintain those really wasn't in the cards for us. But with Thirdway, that way we could get like this hybrid solution that was both AI driven and live agent driven, which really supported our needs. So we'll look at things such as performance. So, you know, obviously call handle times, wait times, patient access, like patients being seen in the clinics, satisfaction of the overall patients through like patient satisfaction survey methods. We're also partnering to utilize some of the other functions that Thirdway offers, such as care gap closures for our managed care population. And then we're going to continue to look at those cost savings related to the labor that I kind of spoke to earlier. I smile because you guys have become so deeply like involved in our organization. We've developed relationships with the Thirdway team almost as if they're part of our team. The providers know them, the staff have gotten to know them. We trust that you go above and beyond to address any of our concerns that we have, and you take on like key operational issues that we've had for quite some time. Well, I have to say that Thirdway's implementation team is probably one of the best implementation teams I've ever worked with. They really got into the trenches to work through some of the operational issues we've had. One of the most impressive things I saw during our implementation period was their playbook. They took the time to learn every single aspect of our operations in terms of what they were taking on. They went around and met our physicians. They really went above and beyond to get to know us as an organization. And so I felt that was more of a partnership versus like a purchase service that we had with you guys as a vendor. So, at this point, we really appreciate that. And I think we've seen a ton of engagement from our providers and our staff. And so with that, it's made the implementation go a lot smoother than what I've seen in other implementations we've done as an organization. So it was extremely positive from my perspective, and I think the organization's perspective for a go live and implementation. Standardization is helpful when it comes to provider scheduling preferences, but that's often not achievable just because providers like things done a certain way. And so specifically in our organization, we try to allow for that type of autonomy. But with that, I think setting realistic expectations internally with teams is really valuable and important. And then getting all team members engaged helps for a smooth transition. Additionally, we found a partner that we could really trust, and there's always going to be unexpected things that come up during an implementation. So like I said before, they came in, they understood what it took to get things to the finish line and how to operate in the healthcare field. Really helpful when we went through that transition. I think what's helpful is that Thirdway's agents speak Spanish, and so every team member we interact with has had great English. There's been no issues for our patients or our staff at this point in time with understanding or being able to communicate with these agents. Well, I think you guys kind of take everything on wholeheartedly, and so that's putting a lot of trust in you guys. But if we can get it locked in and we can get things across the finish line, we would have built a complete digital front door, and we'll have a stronger ROI because you guys are doing things like running insurance eligibility for us. You guys are taking all of our phone calls. And so then we can run lesser front desk operations or be able to focus on a more positive experience in the office for the patients at that point because we're able to redirect our focus. So I like to look at implementation as kind of like a honeymoon phase because we've just purchased services. They want to make sure it goes well. And so usually during an implementation, you kind of get the A team where they're giving high touch, high customer service. Then once you kind of implement a vendor, sometimes we've had vendors where we've just kind of fallen flat. It's almost like they don't care to take our feedback or things don't kind of get addressed in terms of issues that we're seeing post-implementation. We've not had that at all with Thirdway. Their team continues to be responsive to our requests. We specifically want to note that Thirdway is not only a provider call center, but they've kind of brought in expertise to help us transform our clinics. So by way of example, we're looking at things like how can we streamline scheduling across the organization to make it easier for agents to schedule, but also improve patient access, helping us get in some of those key visits, such as our annual wellness visits and things like that help everyone overall. I'm excited to potentially expand to other clinics. I think it's exciting to look at how we can adopt other physician practices. So we're looking right now at trying to roll out some areas such as specialty areas, which is much different than primary care. We are also trying to partner with you guys to improve our RAF scores or our risk adjustment scores with our health plans on our managed care patients. So that's really exciting to me because that's kind of why I'm here. I'm in the business of medicine, and taking care of the people is what matters the most. we didn't really have a lot of technology systems, and so it was the lack thereof. But my previous employer was very low tech. Everything was on paper, so Thirdway was able to help streamline that. With Graybill, we've not had an appointment reminder system for about 3 years now, and so the ability for us to be able to do that and decrease our no-show rate is huge. Plus, in today's day and age, self-scheduling and like text message reminders is like, I can do that. My mother-in-law does that at her hair salon. So the fact that we haven't had that and now we're able to do that with Thirdway is really big for us. Thirdway did save staff, meaning that our clinic was kind of always short-staffed. So we had a lot of turnover. Obviously, with turnover, the training, you have to continue training people, and then with that, like, we had to staff up the front desk. And so yes, overall with downsizing, it was a unique situation because we actually went through a divestiture, so they just came in and helped us fill that gap right away, and so that's part of the reason we chose to partner with them. We definitely see less stress in our staff, have much less turnover at our front desk. And so overall, the partnership has been a positive relationship or impact on the organization.